we are going to look at how we can protect ourselves as journalists, and the same way protect those who love our audiences and everybody else by giving information and behaving in ways that we protect ourselves and our sources and interviewees. This is a third webinar in the line since the COVID pandemic started, when it was still endemic, and now it's a pandemic. As you know, it's all over the world. So in March 22nd, it was classified to be a pandemic. And after that, all those first measures were taken. Here we have a pyramid, which you can see is classified into 4 areas. It shows, if you look at the base, we have mild cases, which are hardest to count. For example, in Kenya, the Ministry of Health had estimated to have 10,000 positive cases by end of April. But as you know, it's less than 400. It shows you there are a lot of cases that are still going around, but the hardest to count since they don't have symptoms. Then if you go up, you have the people with symptoms, them not severe, survive at home. And if you go up, you get severe, where now you go to the hospital, and if it gets worse, you get to the ICU, and unfortunately, if it proceeds, they are dead. The thing about COVID, it is transmitted by vectors, and journalists are vectors. We've seen in a number of cases, journalists acting like they're COVID-proof. They don't take the precautions when they're doing their interviews. They are too close. They don't wear personal protective equipment. They are not COVID-proof. Unfortunately, we have lost colleagues in newsrooms. So this should be a wake-up call to our colleagues. So journalists are people, and interviewees are people. And remember, COVID is transmitted by people. So this should be a wake-up call to all of us. So what's the report right now? We are having over 3 million cases, which have been reported so far, with the United States leading with over 1 million cases. And in Africa, we're having a considerably low numbers, with Egypt leading with 5,000 cases, followed by South Africa. And maybe this is one of the reasons why people are not taking it serious. But what are our testing capacities? Over the last week, we've seen a rapid rise in numbers. And if you look keenly, you'll find out that most of the countries are ramping up the testing. So this is something we should look at. What are the testing capacities right now? Yeah. What does the published data say? What does the common sense tell you about the risk, the new hotspots? Yeah. We should go beyond what is here right now. Yeah. So one of our major roles now, we have to support everybody else to flatten the curve. Journalists right now are like health workers. They are in the front line. And we should give the necessary information, because right now there is a flood of information coming in. So one of our roles now is fact-checking, making sure we give the right information. We debunk the myths. We give information that really helps to save lives. You can see from patient 0, the hill went up, and now we are falling over each other. So just as in medicine, the Hippocratic oath, the same is in journalism. First, do no harm. Yeah? So you do no harm to yourself. How do you do that? Protect yourself. Make sure you follow all the regulations and guidelines that have set. And also by doing so, you're doing no harm to others. Because if you don't protect yourself, you expose yourself, you in turn also harm others. You know, this is a new area for us. You know, we are not used to be thinking about, you know, others when we are going, in that sense, when we are going to do our jobs. So first, do no harm. Make sure you protect yourself. Make sure the information you're sharing is right and it's going to be helpful to all who need it. So basics. The first and foremost is washing hands. And that can be emphasized more. Wash your hands with soap for more than 20 seconds. Yes, that is the first line of defense. Then now we know as journalists, we have all these tools for going out. I mean, for working from home, but from time to time, we'll be forced to go out. So what do we do? Make sure you wear the right protective equipment in the right way. Everybody now is encouraged to wear a mask. This here is from CDC. It shows you how you should wear a mask correctly. You cover your nose and it should go below your chin. But don't worry, we will share this PowerPoint presentation after this session. So don't worry so much about this. We'll check it out. So make sure you have the right PPEs. Yes. On the 17th, a number of countries calling themselves the 4 groups of friends on safety of journalism, of journalists at UNESCO, came up with a joint statement on safety of journalists, because as you have known, in many countries now around the world, journalists are suffering. There is violations against access to information. Journalists themselves are being harassed. There is physical violence against journalists. So countries together for access to information and to protect journalists. So as we are going out there doing our job, we should make sure we follow the regulations set out in our different countries, because we are dealing in, we are in actually unprecedented times. So we might find ourselves in uncharted territory. So it will be safe for colleagues out there. Make sure you know what the regulations say, make sure you understand it, and also share it with friends and family. Like, for example, one common word right now is essential services. What does it mean? Is essential services the same in Kenya as it is in Nigeria? Is it the same in Eswatini? It's different. When you look at the guides that they have set out, there are a number of services which are not appearing on all, but luckily for us, media is classified as essential in all that I have seen. So make sure you know what your country says. Are you in a curfew? Are you in a lockdown? What's the difference? You know, have you been put in quarantine or are you in isolation? Find out, know what it means. What does it entail? And then once you know the information, share it, and find out how this information can be disseminated and help people. So unfortunately, at the moment, we are seeing media houses cutting down, especially in pay. We are seeing salaries being cut down. So they are very, depending on the media house you're in, you can, if you can afford, you have to demand for personal protective equipment. If you as being a freelancer, unfortunately, it's going to be a bit hard, but maybe you can rally around, crowdsource together with maybe the media regulators in your different countries, the people who build the capacity of media in the different countries, so that you can have like a pot where maybe funds can be gotten, and the colleagues who need the most can be provided with this equipment to go cover this pandemic and share the information that's needed. So with this pandemic comes a challenge. We have our revolutionary ways. We have to find the revolutionary ways of covering information in news. The train had started going, the bandwagon, but now it has to go full steam. Some of these, majority of these tools are not new. They were there in use, but now we have to really embrace them. We have to really understand how they work and use them to tell better stories, captivating, impactful, in-depth stories, even when we are working from home. Here is a picture, nice picture of of a nice cart hanging out and all beautiful equipment that now have become part and parcel of our story and information dissemination and gathering. So we continue. You know now, I remember for the journalists who are here, you used to come with footage and you're told by your editor, this is not broadcast quality. Go away. Give me something that I can run with. But now, in these times, content is king. Everybody is shooting content with whatever they have. It's no longer about pixels and how 4K it is, how beautiful the shot is. It's now about content. What information is there? What stories coming out? Yes. And now, instead of relying with our normal networks, we are now more and more broadcasting crowdsourced cell phone videos. Majority of the stories that we have gotten outside here from the wards, from the isolation areas, from the empty streets, have been contributions from crowdsourced content. Radio now has to maximize on the phone-in formats. They have been doing it for a while, and now they have to do it even more. Luckily for them, radio is the theater of the mind. They can use lots of other effects, to take people out, to bring them in, to tell the story, So I think radio now, creativity here will be key, but it's doable. Online productions have been always struggling with bloggers and all these other competitors, and now we have more tools, a lot of more information, a lot of short video apps have come online. So now they have to continue providing what is provided here in initiatives. More in-depth story, more in-depth information. What information is not out there? What is new? What is a solution? Solution-based kind of journalism, something different from what is already there, so that they continue moving forward and providing information that's needed, and not actually seeing themselves as in competition with all these other new popular apps. And, with all this pandemic and having time at home, I saw an interesting cartoon from Zapiro, from South Africa, where it is now we have guys from PhDs from Peter University, from Facebook University. So you have to be very careful of the sources you pick right now. You, as a journalist, you always have your own black book with contacts. Go back to the credible old contacts you used to have. Right now you might very easily be pushing misinformation or disinformation without knowing. So, and now that we are using all these new tools, unfortunately, we have to invest in data and stable internet. I know it might be tricky, but find ways. You can try to get a modem or something, but as a journalist, think on our feet and make things work. So we have to make it work. You used to maybe take 2 taxis to work. Now you're at home. You can save on that and maybe buy data and internet which you can use to do your work. At the moment, after the pandemic was declared, we have a lot of organizations that are coming up with grants. National Geographic, we had Internews, we had Net. So you should look out for those grants. There are grants about telling story about COVID. They can, help you tell the story and support you with logistics. So these are some of the tools which now become very popular. For example, Zoom. In December, Zoom was less than like $10 million worth. That's almost $300 million. It shows you from less than 20 million subscribers in 2019. Now they're doing over 200 million. So it shows you popularity. But there are all these tools which were there before now have become more popular, and we'll have to use them more and more. In more innovative ways to keep telling our stories. And let's crowdsource these innovative practices and share. You might have a tool that you find is very useful and somebody else has not discovered it. So let's crowdsource, let's share, let's help each other tell the stories. So at the moment, you know, guys are asking, what should I do if I have to go out to tell a story, to go cover, go meet somebody who has COVID. So if you're required to go from home to go out, you should be at least 2 meters away from anybody, you know, not just anybody who's infected. We have other guys are saying 5 feet. We have other guys giving other tips, but we say safely it's 2 meters. So always keep your distance. And when you go out, I have seen example or a story done by a colleague who went out to the ward to see what's happening, to talk to the people who have tested positive, and to tell you the truth, they're saying you have to wear all the protective personal equipment, but one of the hardest thing is wearing it, but which they are calling donning, but also doffing, the removing is the most tricky. And it's not just for media professionals, because we also will be not just for health professionals, because we will also be going out. They are saying a number of infections have happened when people are actually doffing, when they're removing the personal protective equipment. So yes, wear protective personal equipment, but be very careful with how you put them on and how you actually remove them. That's very important. When you're in the field, when you get back, make sure you disinfect your equipment. I've seen colleagues shooting from outside the window so that the equipment is not inside the ward. Make sure you don't put the equipment down on the floor when you're in an infected area, you know. So make sure you are safe. When you go in, don't touch anything. So be careful when you go out there. So I've seen not very many guys have the access to boom mics. So when you're going out for these interviews, make sure you have 2 mics. And once they are used, they cannot be used again until they are sanitized. And when you're going out in teams, especially for people who are doing TV, at least minimize the teams to 2. Yeah, opt for places with low traffic. If you have to use public transport, go against the tides, go when it's not rush hour. And here we have a link, which you will see, breaking it down for you more and giving you more tips on how now to disinfect your house and moving on. And because we are now using a lot of new tools, which are all online, digital safety is key. More and more, you're having guys who are trying to steal your email now. Yeah. Over the last month, I've received a number of updates telling me change my password. You're seeing there's increased activity, guys who are trying to hack. So make sure you have long enough passwords which have both characters, special characters, numerals, caps, and small letters. Yeah, save your data. Online privacy is key. Yeah, like I told you, Zoom, newfound popularity was exploited in a phenomenon they're calling Zoom bombing. It's the way somebody comes in your photo. Here, people were hacking that and they were entering into people's meetings and posting stuff with being allowed, but it was sorted. So we have all these opportunities, but they come with some dangers which we have to be very careful and be able to manage. And we've also, as you see, the new tools also, as I said, have come with some danger. You can see we're having a lot of unsolicited fake news, unverified information, the veracity that's out of this world. like pray and Corona will soon go away, you know. So you have to be very careful about what you're hearing. Yes, you have all this flood, but we should have a responsibility. You're seeing platforms like Facebook right now. When you log in, first they have all this reliable information and platforms where you can get reliable, safe information. Yeah, so we should also take an individual responsibility to make sure we are doing the same. So how do we do that? You know, we stay level-headed. You know, things which excite you easily and that you want to share quickly, you have to be very careful about it. Yeah, very easily be misinformation. So number one, where's the source? Because right now we have all these tools that can create Facebook pages, WhatsApp, we can create tweets. So where's the source? Where's the original source? No source, no forward. Yes. Always, as in journalism, what's the golden rule? Whenever in doubt, yeah, when you're in doubt, you leave it out. The same way, it's no longer about who's breaking what fast. Now it's about who's giving credible, reliable information that's going to help people. Yeah. So work more on how to debug myths. You know, check out the tools that are available on verification. Verifying images, verifying videos, you know, looking at all those deep fakes. Now, by good chance, we have all those tools available, and most of them are free. So we have no excuse of sharing unverified information. Mental health is key for us, for people who are in isolation, for people who have contracted COVID. Like in Kenya now, there are some disturbing videos of people who are in quarantine who have become suicidal. In social media right now, you're seeing how angry people are. They lash out at anybody over something small. That's frustration. So we should be careful. We should take care of our mental health, you know, consult world-based practices. Like I said, currently now we have World Health Organization and all our ministries, different ministries in countries in the regions are working closely with the World Health Organization and have set out different directions to be followed. So we should follow that. And before there is a crisis, inquire about local support first, you know, and then make the information available to colleagues and friends, make them aware instead of, you know, being too fast to rush and share stuff that might be too scary. So make sure you find out what's really happening before now you you share the information to colleagues and friends. From time to time, it's good, you know, to take a break, you know, take a bit, you know, read a book, watch a nice movie, you know, do some nice workout, you know, connect with loved ones online, in the house. It really helps to ease down stress and tension. But as you know, there are lots of challenges. But with challenges come solutions. So in many cases, we had people in informal settlements in Africa saying, like in East Africa, saying, how can I provide social distancing? But it can be looked at in a couple of ways. It can be you stay in your house as your unit. Yes, it may be small. Stay in a unit. Make sure you don't interact with people who are outside your cycle. Yeah. So it's doable. It's not just about being together. And then there's the social distancing when you're going out. You know, the number of people who are supposed to be at a place at a particular time. You know, we are seeing a lot of people now taking shifts, going to work, even media houses. So these things, yes, it's a challenge, but there's always a solution. We know right now people are not earning much income. So if you look at, so what should I look at? So what's my priority? Is it data or is it food? So we know it's a challenge, but you know, when you do the good stories, maybe something might come out of it. You never know. So I challenge you to let's work hard, let's do these stories, let's tell these stories innovatively, and maybe something can come out of that. We know there's a deepening digital divide. There are some regions which are very good, reliable internet, others don't. But as you know, journalists, you think on their feet, there are a number of ways which this can be overcome. So yes, it is a challenge, but you can come together as 2 or 3 guys, pool your resources together, come up with a modem which can be shared maybe once every 24 hours or something like that. You know, I know right now everybody's stressed. There's some editors who have become very uncooperative. Unfortunately, that's the situation now. We are in uncharted territory, you know. So patience is key. And you know now newsrooms and platforms of survival and sustainability has come to question. We are seeing newsrooms branching into new directions. There's now a lot of solicitation for guys to register for e-newspapers. Podcasts have become popular. And so guys are looking at other ways to monetize digital data. It's a challenge, but yeah, moving. So states is controlling communications because yeah, like you see, there's a curfew. There are guys who've never covered a curfew before. There are guys who had never seen what a lockdown is. So it's all new areas. So and the government has been so high-handed. We've had journalists who've been injured. We've had journalists who've been arrested. So, and we know journalism is not a crime. So let's try as much as possible to work within the laid out rules and regulations, and let's also be together. Let's be together. Let's support each other. Let's call out injustices whenever they happen to a colleague. Unity is always strength. And as you know, with technology, there'll always be glitches. I know there are guys who have been caught up with the last minute print. You're in an emergency, then the printer breaks down, you know, or you're just about to make a presentation, and power goes out. So glitches will always be there. There are all these challenges and also solutions which can come out, and we can go on and on and on. But what I'd like to tell you is stay safe, stay home, and thank you very much.
Thank you, Tore. I think now people who have questions, interventions, they're welcome to raise their hands. Just click on raise hand or send your questions on on chat here. If you have question, you raise your hand, and then we give you time to raise your question. Or if you have an experience, you are welcome to share. Thank you. So, meanwhile, Ida, do you have something to add?
Yeah, I think, thank you so much for that, Tole. I think what I wanted to add is just a reminder of how Tole started his presentation, is that it's so difficult for us to imagine that we ourselves may be infected, or people who look perfectly healthy may be infected. That's the major challenge. That's actually why there is denial about this disease. That's why people get caught unawares, as it's really perfectly possible to be infected with this virus and to not show any symptoms. And it seems quite possible to be infected and to actually even be able to transmit to others. So it's very difficult to get one's head around it, because we are used to the fact that if you're infected with something, we feel it somehow, we can feel it in our bodies, or people can visibly see it. I think it's just important to remember that. And I just wanted to add a dimension to that, which is that, of course, it's also a reason why stigma has no place in any disease. But I mean, specifically here, as we are so focused on COVID-19, anybody could be infected. It could be by simply being a little bit, I don't even want to say careless. I mean, before we knew more about this virus, we might have passed somewhere and touched a surface that somebody else before had just touched our face. That's hardly being careless. It's just being human. So we're actually being called upon to do things that we have never had to do before. And to just bear that in mind every day without becoming paranoid, without becoming kind of people who don't relate to other fellow human beings, obviously. But it's a thing to bear in mind. It's actually quite difficult to get our heads around that. So how that translates to our work is, we could be walking out in the street, we feel healthy, the person we're interviewing feels and looks healthy, but it's still a risk environment. That's what's so entirely new about this. Thanks,
okay, thank you very much. I've seen Yuri has a question. Okay, go ahead.
That's true. I had to switch on my radio. Oh, thank you, Tole, for inviting me to that meeting. That reminds me of old times when we were training together in Kenya for DW Academy. Now there are no trainings going on. Everything is distance. And I hope we get training opportunities and you get training opportunities online. I'm working now as a reporter, and I would like to add something. I find it still crucial that we don't stay too much in our rooms at home and do online interviews all the time, because people can tell us a lot of things and lies and misrepresentations. It's still important that reporters go out and see for themselves and report what they see. And that is what I see as my task at the moment. But we have to, of course, be safe when we do it. And there's one safety measure that you mentioned. You measured the 2 microphones thing. Huh? I doubt this is possible for many people, because if you have 2 microphones, you need 2 recording devices, or you need a mixer in between, or whatever, or you need wireless. I don't know many people and many reporters who have that. I know people who record with their phones, and I know people who have small things like that. And I don't even know many people who then have a external microphone to be added, at least not in where we have been in Kenya. So I'm experimenting as a reporter at the moment, and I'm inviting you to experiment as well with things like that here, huh? Which is a pole to clean. Huh? And you can somehow attach your mobile, your reporting device here, and then keep that distance of 150 or 2 meters. And you might buy a cheap one, but then an extendable one for cleaning rooms. And then you can keep that distance. And this is, but you have to also check on it. There can be a lot of disturbing noise from that pole. So you have to train at home before you do that, and check the recordings that are done by that. And that has a second effect. I mean, it not only protects ourselves and the others, it also keeps them in the programs. We experience now, I'm sitting in Germany, but we experience also people who do not want to give interviews in person, or don't want to let you in somewhere because they want to keep their distance. And if you can assure them that you keep your distance and prove it, then you might get these interviews or these visits to places still. That's my 5 cents.
Thank you very much for inputs. Tore, can you comment on that?
Yeah, as I said, with all challenges come solutions, and that's why we were saying we crowdsource, we share what works. So this is a good example of just that, what Uli has said. So as I said in the beginning, this is a peer-to-peer interactions. So as you can see, we all have something to offer. So I'd encourage my colleagues in the other regions maybe to give us a quick experience of how they are doing it in the different regions. Maybe a maximum of 1.5 minutes each, please.
Sorry, you say? Okay,
I'm saying, we are saying if our colleagues can now, if we've opened up the plenary,
yes.
Uli has opened up. So if other colleagues can jump on the wagon and also share, that would be great.
Okay, anyone else who have experience can share. But there is a comment here, intervention from Leo M. To our presenters, in some cases you might need to cover a story which might require some materials from ground or field. Yet there is a possibility of the people on ground to gather some for you. What are the materials that could you recommend to help you out in a such situation? Thank you.
I think recording equipment is key. Luckily now, we have even the non-smartphones have recorders where when you have an interview, it can be a simple phone interview and you record it. And then since we have all these editing softwares, we can see how much we can try to improve it. But now we just start with the basics. Luckily, all this new technology has all these inbuilt record buttons. Smartphones have them, even the other banner phones have them. So for that recording from the field, you can just tell them to record. And if it's radio, they'll record and simply send it to you.
Yeah, thank you. We have Salom Philly. Salom Philly, can you go ahead?
Okay, yes, good afternoon.
Good afternoon.
Salome here from Zambia.
Yes, go ahead. Yes, can you hear? Can you hear us?
Yes, I can hear you, yes.
Okay, thank you. Go ahead.
The question for those, yes, for those journalists that are not really in the epicenter towns in terms of reporting, so how do you strike a balance if you're just a correspondent and not really in the city where the COVID-19 is already rampant, but just a correspondent in a different city where there's no case yet? How do you strike a balance in going out there to source for stories and also ensure that you keep safe? Because in as much as we have COVID, life has to go on, news has to be delivered to the editors, and they're in a different town where COVID cases are still not yet reported. How do you strike a balance in going to source out for news out there and also keeping social distancing?
Okay, thank you. Tore, I think you have got the question.
Yes, I have got the question.
Okay.
I have had, unfortunately, most of my colleagues are coming from areas which have had cases of COVID, but I have a few in the marginalized areas. And currently, we're saying there's very little movement, and the pastoralists, are not moving across the borders. So crime has gone down. So majority of the stories they are getting about COVID. Everybody, when you go out, you want to interview someone about something. They're saying, "Oh, so how about COVID? What have you had?" So I think now it's up to us to add more stories. As I said in my presentation, it's good to take a break from COVID from time to time. But at the moment, majority of the people are in areas where this has happened, and the ones who are not in areas that have had very high numbers are trying to get information from areas where they have high numbers with regards to preparation, because in areas like I remember Uganda for a very long time had 0 cases while all the neighbors had issues, and they were actually moving on with life as normal until then. So more stories are coming out about prevention. So if you don't have cases, so how are we going to protect ourselves so that we don't have this happening? Yeah, what are we going to set out? What is the Ministry of Health planning? What has it set out? Do we have enough number of say equipment, hospital beds, that kind of thing? But yes, there are other stories which are covered, but as you said, it's good to balance, but majority now is about COVID. But there are other stories, and especially good ones too.
Yeah, thank you. Someone using the oh, Yuri has to add something. Go ahead.
Yes, I wanted to share something and ask you a question about that. Salome, you were talking about the other stories that have to be covered, and and I agree. I very much agree what you say. The life has to go on, and there are other things going on. I recently had, not presently, I'm having a story which is critical about the city where I'm living, and I want to push that to the media here. And I asked the city about their stance on it. It is critical about the administration's what the administration does. And they said, we have no time, it's Corona. Huh? We have so much to do with Corona. You cannot answer your questions about that topic now. And we don't give you an interview at all because we don't have time. Is that a common experience among the colleagues who are here, that if you want to report on something else, that Corona is also an excuse to sidestep and dodge?
Yeah, thank you. Do you have some comments on that, Tore?
Yeah, it is, and that's why we are seeing people are pushing and doing all manner of noise about access to information. They are using that, and unfortunately, in some areas, there are movement restrictions. So you might get there, you don't get your stuff, you know. So it's pretty tricky at the moment. So yeah, I can say we are struggling to.
And what's the way out? Do you have hints and tips?
Yeah, people have lodged lawsuits. We are waiting for the determination. You know, you just have to follow the law. There isn't much you can do at this particular time. You can't pick it; it's illegal. So you know, you just have to follow the law.
Yeah. Thank you. Okay. Okay. Thank you. Okay. The next is using iPad. Please introduce yourself and go ahead.
Okay, my name is Louisa. I'm in Nigeria, Lagos, Nigeria.
Okay.
Yeah, since we have similar issues, like the last speaker said, we also have some sort of restrictions here.
Go ahead. Hello? We are not hearing us.
No, the mic is mute. Our mic is mute.
Okay, can you hear me now?
Yes, we can hear you.
Yeah.
Okay, I said my name is Louisa from Nigeria, and just like the last speaker said, some African countries have some sort of restrictions.
Yes.
When it comes to movement. Am I loud enough?
Yeah, you are.
Yes, but
Fourth Avenue
recently they've
behind
tried to
City
make
Mall.
that easier and
Yeah.
allowing us some.
Sorry. Can you repeat the question?
No, it's not a question. I was just trying to.
Okay, can you repeat the intervention?
Can you hear me?
Yeah, we can hear you now.
Yes,
I was just trying to reiterate what Mr. Ulil said, that it seems in some African countries there are restrictions, I mean, lockdown generally. But for us in Lagos, Nigeria, you know, Lagos has the highest number of COVID-19 cases in Nigeria. And just yesterday, we recorded about 80 new cases in Nigeria. And of course, Kano is one of the states now that really have this very great fear as to how the numbers are increasing by the day. And most of this, most of the things that are attributed to the fact that their level of literacy there and the fact that some of the state governments in the north did not really take this whole COVID-19 issue seriously. And so that is affecting that part of the country. But all in all, Lagos has been not too harsh. The lockdown in some parts of the state are not really adhered to. But as journalists, yes, we go about our duties in ways that we can. But it's just that in all of the palliatives that are going round, I don't think there are any for journalists right here in this part of town. I don't know if you have any special stuff from your government in your countries, but we're just there trying to make the best of it and give people as much information as we can in Lagos.
Okay, thank you very much. Your comments, quick comments, Tore, we are running out of time and we still have some questions and intervention. Thank you.
And thank you very much. I think that's good. That's what we'd like to hear more colleagues sharing about the experience. Please go ahead.
Okay, there is, we have a question here. I am Desile from Internews, Rwanda. I would like to ask, which is the cheapest way that journalists would be advised to use for protecting themselves in time of covering COVID-19 news on field, when they don't have financial ability to have real protection tools? Thank you.
You know, there are no two ways about it, unfortunately. You have to get protected. You have to, find personal protective equipment, and it has to be of the right standard. Otherwise, if you come up, we've had instructions of how to come up with masks, homemade masks, and there are areas where in the public you're provided with sanitizers, and there are taps to wash hands. But I think if you're going out to film and you don't have, it depends with what you don't have. If you don't have equipment, is it that you don't have equipment, or is it that you don't have money? Because if you don't have equipment, what have you been shooting with? So if you've been using your phone, you can still use your phone even during COVID time. Nothing much changes. Uli has showed us an ingenious way of keeping your distance. Yeah, if you follow the regulations, make sure you keep your distance. At least you have a basic mask, and you're out in the open. They say at least there's air. I think you have the basics. If you follow that, I think you have it. But if you don't have personal protective equipment, it is not advisable to go anywhere near an infected person or in an infected area. So yes, you can still film using the basics that you were using before, find ingenious ways, make polls of creating distance. Make sure you wash your hands, the basics that we are being told. And as I generally say, you can find ways of coming up with some standard mask if you from clothes if you can't have one available. I think that would be my 2 cents.
Okay, thank you very much. We have someone who is identified herself or himself as iPad. Can you go ahead, please, introduce yourself?
All right, thank you, Christoph. My name is Jacob. I'm based in Mombasa, Kenya. I'm very happy to be invited for this conversation. I just have 2 quick comments, and I would like to say that this is a very timely conversation, very important. My first comment is the other day I was watching one of the media houses in Kenya, and one of the reporters started giving the story, and then he was asked by somebody from the station. He was at the field, and then there's someone at the station talking to him. And he was asked, why don't you have a mask on? And then he goes like, oh, I have one in my pocket. And then he goes in and removes it, then puts it on and continue with the story. So I think the discussion that Tole has brought is very important, because journalists, actually, you are part of what we call essential services. You're probably doing almost as much as what the health workers are doing. So you need to protect yourself. My second comment is I would like just to say, when you have these kind of forums that you're able to engage maybe the Ministry of Health or your local health authorities, kindly keep on pushing the question of mass testing, because I feel that even in like where I am in Mombasa, they keep saying it's a hotspot, but when you look at it, the fact is they're doing more tests in Mombasa than they're doing in the next county. So you cannot really say this is a hotspot when more tests are being done here and not in the next county. So I'd just like to share those 2 comments and say I'm very grateful to be in this meeting. Thank you.
Okay, thank you very much. Tore, the floor is yours.
Let's take as many comments as we can.
Okay, we are running out of time, but let me pass through those comments. Good afternoon. Glad to be here. That is Freddie Mo. Glad to be here. Good discussion ongoing. My comment would be for the journalists that are getting used to the news tools. They need to tighten the information. Audio on WhatsApp is limited to send. It's limited to send a small file. WeTransfer is free, but charges for pro usage. Okay, thank you, Freddie. Let's take another one who is using, identifies himself and, okay, Fatima Mulaina. Can you hear us?
Yes, I can hear you.
Okay, go ahead.
I can hear you. My name is Fatima Mulaina from Akure, Ondo State. Fatima Mulaina from Akure, Ondo State, Nigeria. I want to ask, you have recommended that working from home is the best practice for this our profession, sir. So how would one get the contact to access one source of information, sir?
Okay, Tore.
Can you hear me?
Okay, we can hear you.
Can you hear me?
Yes, we can hear you well.
So Fatima, working from home is one of the ways.
How would one get the contact to access source of information?
Can you come again?
Working from home.
Okay, can you come again? You can't get the question out.
I said,
the question
how would journalists get contact to access one source of information if we are working from home? Because we have recommended working from home as the best for our professional practice.
Okay, Tori, some tips to gather information from home. Yes.
So, Fatima, working from home is one
Yes, gathering
of the
information
ways.
from home. Okay, sir.
Yes.
It's one of the ways which we have to work with right now. So, as we said, for a journalist, there are times you'll be forced to go out. So, work from home with what you have. Most of the journalists usually have their own black book with their experts and their trusted sources. So that's what most of the journalists are using right now. Trusted, verified sources who have been there before. But that's not the only way. There are times which you are forced to go out. And that's why in the presentation, we were talking about the personal protective equipment, making sure you keep your distance using innovative ways. So yes, we saying this is one of the way, but it's not the only way. So I think to answer your question, if you use your own trusted, verified sources to tell the story if you're working from home.
Can you repeat? Someone has interrupted.
I'm saying, so I think in a nutshell, if you are working from home, you use your known, trusted, verified sources, which you have been using before, especially in these times where we have experts from all over in the social media.
Yeah, the other thing I can add, you can, if you are working with a radio, with a television, there are those platforms that are very complicated now for working from home. You can ask you can ask yourself, your source to record themselves and give you audio or video you may need that you can use in your reporting. It can also work and minimize risks. So, another question here. Okay, I am Betty from Liberia. We have experienced Ebola and now COVID-19. I'm thinking what other angles can be looked at comparing the two. Are you getting the question? I'm thinking what other angles can be looked at comparing the two.
Yeah, I'm thinking, hi Betty, I think it will be very helpful to the conversation if Betty can share how they covered Ebola, and that I think will be very interesting because I've seen in other schools of thought, they're saying guys who have covered Ebola got some kind of preparation and better prepared and still to cover COVID-19. So maybe, Betty, would you be so kind maybe to share how it was very quickly covering Ebola?
You say? Tole, can you hear me?
Yes, I can.
You say?
I have said if Betty can share with us how it was covering Ebola, because there's also a number of colleagues who did not get that chance of covering Ebola, but now are facing themselves with this pandemic to cover. Maybe there's some lessons that were picked during the coverage of Ebola that we can learn during this meeting.
Okay, I don't know. I'm not sure if Betty can hear us now.
I'm here.
She was okay, Betty?
Yes. I'm
okay.
Here,
go ahead.
I'm here, to Christopher and Tori. So for Ebola, it was a whole different scenario because I can say that we wore PPEs and there was no lockdown as compared to what it is now. We had the previous government giving us accounts of cases, and they also fought a way in which journalists and could be protected. But now it's totally different. There's a lockdown in all of the 15 counties, and we have issues of women access to health facilities, and there's no essential needs provided by government. So it's totally different now. So there are a lot of hurdles, and there are a lot of angles that I think it's important to look at as a journalist.
Yeah, I totally agree. And maybe if I chip in for this particular pandemic, yeah, apart from just the numbers, so what is the economic impact? You know, we are seeing now an increase in hygiene. What has other diseases which are caused by no non-hygienic practices? What has happened to them? Are they up? Are they down? You know, we can look at, you know, the small shops in your areas, you know, tell stories about people, the laborers who are not be able to have not been able to go to work. What's their life like? You know, it doesn't just, it can be related, but there are also other lots of human interest angles that can be done. And for any other journalist who might want this kind of mentoring, kindly drop your email and then we'll be reaching out. And then if you have, if you'd want any kind of support, be it story support or any other support, we can discuss this further on a one-on-one basis.
Okay, thank you. As we are closing, we are running out of time. As we are closing, I want Ida to make some comments and give us also take homes. Ida, can you hear us?
I do. Thank you.
Okay, thank you
so much for that. Right. Thank you so much for everybody's comments. I think in future we will also really try to make that a discussion so that everybody can participate. Some of these webinars can be very long on the presentation and short on the participation. So great for the comments that have come. I want to thank Betty for giving us more information about Ebola, and to also let you know that one of the upcoming webinars we are planning is about what lessons can we learn from Ebola to take us into COVID-19 reporting, what's different and what's the same. And we will also have one on lessons to take from HIV reporting, what's different and what's the same with COVID, because those journalists who've covered those two epidemics already are equipped actually with a lot that has to do with COVID-19. I also really, I'm very thankful for Fatima's very important question about what do we do when we go out in the, you know, if we are saying the recommendation is report from home as much as possible. It is a challenge, but I think we can also try to find creative ways, like for instance, we all totally talk about a black book. Maybe it's the contact on our phone. Over time, of course, as we've done stories when we were still able to freely go out there, and we start gathering the names of contacts on our phone. If those names are on a notebook, it's a time to get the notebook and put them on our phone, so that because they become our usual WhatsApp interactive contacts. Another thing that I've thought of is that sometimes maybe you want to tell the story about how a store in East Africa, say a duka, you know, like a small store, is coping maybe with fewer customers going around. You may know a store owner, and that store owner may be part of an association of store owners. To think differently, how innovative we can to say, okay, I don't have a contact at the hospital, but I've once been to the chemist attached to the hospital. Look for your receipt or look for the chemist whose number might have saved And that chemist might not be the one from whom you want the story, but because the chemist is inside the hospital, they may be able to give you the contact of a doctor who works in the hospital. That kind of thing. In other words, roundabout ways of finding contacts. I just also wanted to say that story about, it was mentioned, what about all of the rest of life that's still ongoing? Malaria is still a problem. Vaccinations, immunization still has to continue. There are actually a lot of webinars being advertised for people with a specific interest. For instance, interest area, marking this point. Remember, malaria still kills. Malaria is a problem. So maybe through what you see online and through and innovative ways, you can still keep on chasing those stories. Just no longer a matter of walking out in the street and finding it, but finding it via contacts, via what you see online. It's tough, but we just have to be more innovative now. Thank you so much, and great for organizing this, Christoph, and thanks for your presentation, Tole.
Thank you. Thank you. Thank you to everyone who has participated. I don't know if Tori has to add some 2 or 3 words, then we close.
Yeah, thank you very much. It has been an eye-opener, and I'm very sure colleagues from different regions have enjoyed and taken home a lot of information from other regions. Let's keep this going. As I said, I am available for one-on-one conversations. I'm seeing emails which have been dropped here. We'll be reaching out together with Christoph to see how maybe we can develop these story ideas we are talking about here and help each other continue telling good stories and providing good information to make impact in lives.
Okay, thank you very much. Bye. Let's keep reporting responsibly. Together we can do more. We can save lives. Information save lives. Thank you very much. Have a good evening. Good afternoon. Thank you.
Bye.
Bye. Bye.